A very good afternoon to all of you. And as far as the topic of concern is there, we have got PCOS, Polycystic Ovarian Syndrome, a modern pandemic. And here I'll be discussing a brief about it because it's a matter of concern for the young girls, especially, and their parents as well. It has got so many implications as far as the psychology of the young girls is concerned, as far as their future reproductive criteria are concerned, as far as the bearing it has got, the burden on the society, the mental burden, the social burden, and so many issues associated with polycystic ovarian syndrome. So, as far as the clinical condition is concerned, we just discussed in brief about the PCOS pandemic. So what happens with this? You usually have got so many features as far as PCOS is concerned, but one of the important facts which remains is that it is considered as one of the common causes of infertility. So female infertility, young girls, and PCOS is the thing which comes to our mind, and that is just the tip of the iceberg. But as far as the clinical detection of the cases are concerned, especially in underdeveloped world, in the areas where we do not have the especially the imaging facilities as simple as ultrasound, these cases remain a bit, stay under the cover, and there is the silent pandemic. So what the data we have got from the countries or the states, it is not, say, a true reflection of the actual PCOS syndrome. So there's a silent pandemic which exists because a larger and a broader population base remains undetected, and especially in certain areas where the girls themselves are a bit reluctant to seek medical advice. That's what adds to the burden of the PCOS. And because of the fact that this PCOS, as far as our medical knowledge is concerned, has got a genetic basis, it might be having an environmental basis, and there are the multiple factors which trigger the PCOS syndrome. Basically, once we just take the patient into consideration, what is the basic pathophysiology is that there's a marked alteration in the physiology of this young girl. And what usually happens, the androgen levels are increased. I mean to say that the serum testosterone levels are increased. In addition to testosterone, androstenedione and DHES levels tend to be on the higher side. So that is as far as the biochemical values, the lab values are concerned. In many cases, there is this surge in LH. LH hormone levels are increased. Estrogen levels are also increased. And now that is as far as the, uh, hormones concerned with fertility and hormones distinguishing between male and female factors are concerned, androgens and estrogens and LH, etc. But on the other hand, once there's the metabolic profile, that means the insulin levels, the LDH, cholesterol, and triglycerides associated with, infertility, there is this whole spectrum of cases wherein the girls present with, impaired glucose tolerance, and there are the high cholesterol, obesity is there. So associated with PCOS, as far as infertility is concerned, we have got these girls also coming with multiple manifestations like full established diabetes mellitus or impaired glucose tolerance, as well as hyperlipidemic states, hypercholesterolemia, hypertriglyceridemia, as well as obesity. So it's not, the issue is that these patients do not come only in endocrine clinics. These patients can come in medicine clinics. These patients can come to a dermatologist. These patients can come to a general physician, so to gynecology obstetrician as well. So usually they complain. What is the main complaints these patients, these girls have? They have got persistent acne. I mean to say acne vulgaris, and that is, mostly resistant, and it's of a severe degree. And then there is this hoarseness of voice, the male pattern voice, hirsutism, and persistent acne as well, in addition to coming with these skin changes like acanthosis nigricans. Now, acanthosis nigricans is associated with a whole range of conditions, sometimes, unfortunately, GI malignancies, which is there, but important is the manifestation in the form of a female presenting with simple acanthosis nigricans and having PCOS underlying obesity. They are overweight, and this leads to multiple metabolic complications in addition to obesity itself. And a very important thing, irregular menstrual cycles. These females usually have oligomenorrhea, and that is one of the important features. So a patient can come to a whole range of clinics, medicine clinic, dermatological clinic, a gynae obstetrician, and especially in case of unprivileged societies, as I mentioned, these facilities are not available and these cases remain undiagnosed. So various important methods of improving the screening for PCOS, because it has implications on the fertility of a female, that is needed ahead. String of pearls appearance. The polycystic ovaries gives a characteristic as is shown over here in the figure. The ovaries studded with multiple cysts, and that gives a string of pearls appearance radiologically. Now, there are various criteria which govern the PCOS, I mean to say, in addition to the clinical symptomatology, and basically for the diagnostic threshold, we have this Rotterdam criteria, which is the universally accepted criteria for establishing the diagnosis of PCOS, and the patients must exhibit at least two of the three criteria for a confirmed PCOS diagnosis: symptomatology, clinical signs, and radiological. So a combination of the three things, symptomatology, the lab, and the radiography, which just helps in establishing the Rotterdam criteria. And now, what is the important? Important is the focus on the clinical management. So what do? We just target the patients presenting with infertility and those associated abnormalities. So what is important? First of all, Universal Foundation, they suggest that it is important to change the habits of the PCOS patients. And one of the most important and underrated things is a change in the lifestyle. What is recommended is to decrease the obesity, decrease the weight, which might sound a bit, I mean to say, very light on the mind of the patients, but essential regular exercise and high fiber diet. Statistics and studies all around the world have shown that these simple things can have a large effect, minor things having a large effect on the outcome of PCOS, and they help a lot in, I mean to say, the management of PCOS. PCOS is not only about drugs. So the medical therapies, and we see a lot many patients. The epidemic is so wide that you see every other girl with PCOS taking drugs. And what are the drugs? Metformin. Metformin is one antidiabetic drug which basically improves insulin sensitivity. But important is that it has been found to have a role in the management of PCOS. The symptomatology and the outcome of PCOS patients is rapidly and over a period of time significantly, if not rapidly, improved by use of metformin. For a long period of time, we take metformin and the outcome is positive. Cyproterone acetate helps in menstrual regulation, and it is a drug which might be given in combination with metformin, and it is up to the endocrinologist to detect the I mean to say, the stage of PCOS, what he wishes, in addition to the dietary and the, I mean to say, other changes which he wishes to include, depending upon the weight, depending upon the other presentation, acne, hirsutism, and the level of obesity which a patient has. Anti-androgens, they have been using these anti-androgens for the long period of time. Now we find many females taking either spironolactone or finasteride or flutamide. Basically, these were drugs meant for some other purposes, like I mean to say, some of them diuretics and some of them used for male conditions like prostatic CA, BHP, and other things. But they have been found to have an effective role in controlling or just preventing the disastrous consequences of PCOS. So spironolactone, finasteride, flutamide are given nowadays. In addition, many of the endocrinologists and gynae obstetrics people just use inositol, and that is utilized for insulin resistance improvement, because the basic pathology of many of the PCOS patients is insulin resistances. So these treatment pathways are highly optimized, usually for the unmarried patient or those who are not actively seeking conception. So important fact is that this PCOS is a modern pandemic, and then we have got these lines of therapy: first line advanced pharmacology, and in case we do not find, I mean to say, we have to we don't find the improvement, then we do, for example, advanced pharmacology with HMG, HCG, purified human FSH, and pulsatile GnRH factors, which are there, which we give under a supervision of a specialist. And in case of, I mean to say, low response rates, we do surgical intervention in the case of LOD, laparoscopic ovarian drilling. So we do the drilling of the ovary of the follicles, and in association with that, the wedge resection. So these are procedures which are done by competent surgeons. But over here, you have to remember that these are the various modalities by which we just treat this PCOS as far as the severity is concerned. So basically, what is important, the mandatory case for long-term endometrial protection. So PCOS, due to significantly increased risk of endometrial CA, there's a regular targeted chemotherapy which is mandatory for long-term protection, because chronic anovulation causes unopposed estrogen exposure and endometrial hyperplasia. And for the pathogenesis of endometrial carcinoma, endometrial hyperplasia is one of the prelude and important factors which can just lead to the development of endometrial carcinoma in many cases. So endometrial hyperplasia, the endometrial thickness is to be monitored over a period of time, so that the patients do not land with endometrial carcinoma. So that is one of the warning signs, and these are the important factors which you have to take into consideration. So PCOS as a disease entity, a modern pandemic, has to be taken care of. I thank you for your attention and your concentration. Thanks a lot.